I am excited to welcome you here to Science and Engineering Hall at the George Washington University. We're really honored to host this year's CyberMed Summit here, in the heart of our nation's capital, a very appropriate location for it, especially with the connection to all of the relevant government agencies, as you've just been discussing. My colleagues have told me some about the summit, the history of it, the mission of this summit, and it very much resonates with our mission here at GW and within our School of Engineering and Applied Science, in particular working across disciplines to solve some of the most challenging problems that we face as a society. And you're definitely tackling one of those here. And this summit's mission actually is also very much in line with my own research program over the years. So I've worked in the smart and connected health space for over 20 years now, building wearable wireless sensors well before there were Fitbits and smartwatches. And back in those early days, even, I very quickly realized the importance of security in such systems. So back then, when our packaging, this was before 3D printing and all of those other kind of nice flashy things, the packaging of our system was electrical tape around a printed circuit board, and we would ask people to wear them. And so their primary concern was aesthetics and comfort, but their very strong secondary concern was about security. We got those questions right from the very beginning. Who's going to see this data? How will my privacy be assured? And then, of course, as our systems evolved and our sensor systems turned into actuators, as many medical devices have, that of course created additional concerns of safety and what risks a hacked medical device might have. So, of course, as an engineer, I worked on technical solutions to try to address these security and safety issues. But I also quickly learned that wasn't enough to address the user's concerns. I could explain all the algorithms that we were using to secure our systems, but there really are so many human factors issues related to behavior, psychology, sociology. Then, of course, there are policy and regulatory issues that were very critical and that could also make or break a technological innovation. And so, of course, there's been a lot of progress on all of these fronts over the past 20 plus years that I've been working in this space, but there is still so much work remaining. And of course, the capabilities and therefore the associated risks of medical devices continues to rise. And the capabilities of attackers continue to rise as well. And of course, then the policy and regulatory environment is getting sort of more complex as a result. But I know that there are many of you in this room that are working to try to streamline the way that we regulate and can provide security and safety assurance of these kinds of systems. So the work that you all are doing and the mission of this summit is extremely important. And I wish you all the very best of luck as you continue to move this field forward and to make medical devices safer and more secure. For those of you who don't know much about GW and our engineering school, I'd like to share just a few details of this university that is hosting you here today. So GW is a global comprehensive research university with 10 schools and colleges, ranging from our schools of medicine and public health to our top-ranked schools of law and international affairs, all right here in Foggy Bottom. And altogether, we have about 26,000 students, including about 10,000 undergraduate students. And as you know, we are just blocks away from the White House and the State Department, and just short metro rides away from the Pentagon, the National Science Foundation, NIH, the FDA, NIST, and countless other government agencies, national labs, and companies, including a rapidly growing biotech sector as well that I'm sure many of you are involved with. Now, GW Engineering is a relatively small R1 engineering school with 82 tenured and tenure track faculty, about 850 undergraduate students, and about 1,800 graduate students across 6 academic departments. But we're made larger by the connections that we have across GW and the partnerships that we have throughout the DC area. And this stems from the mindset of our faculty and students, which we refer to as engineering and ... And this phrase comes from the many conversations that I had with faculty and students when I first arrived at GW back in 2019. And I just simply asked the engineering faculty and students why they came to GW. And their answers all had this engineering and dimension to it. The students knew that they wanted to be engineers or computer scientists, but they also had interests in public policy, law, international affairs, medicine, public health, and all of those other things that GW and DC is known for. And they wanted to study engineering and computer science within those contexts. And our faculty have deep technical expertise in data science, machine learning, fluid mechanics, cybersecurity, systems engineering, nanoscience, et cetera. But they came to GW to collaborate with faculty across the university and to partner with federal agencies, national labs, and companies throughout DC to leverage the power of engineering to achieve societal impact. That's really the messaging that I heard time and time again from our students and our faculty. So a great example of this is our effort around what we call trustworthy AI. So our faculty have deep technical expertise in artificial intelligence, but our focus here on trustworthiness is based on the recognition that trust is not just a technical problem to be solved, but is a social construct that cannot be ignored in the rapid proliferation of these kinds of technologies. And this, of course, requires considerations of policy and law, and ethics and equity. As such, we're working closely with our schools of law, media and public affairs, public health, the School of Medicine, and others to really dig into the critical issues of AI and trust, and what does it really mean to trust artificial intelligence. Last year, we launched our National Science Foundation funded research traineeship program on the co-design of trustworthy AI and future work systems. And this is our school's first ever NRT grant like this from NSF. And our success in winning it is largely based on this engineering mindset that our school has that drives us to take on these really complex socio-technical challenges. And similarly, we're a finalist for an NSF AI Institute, which would clearly be a game changer for our trustworthy AI initiative and further position GW as a leader in this increasingly important space. So we're taking a similar approach with our efforts in energy innovation and sustainability as we connect core technical strengths to critical policy, business, and social justice issues that largely determine the societal adoption of new energy technologies. And of course, very relevant to this summit, we recently launched a Cyber at GW initiative that connects our technical expertise in cybersecurity with policy, law, human factors, national security, and other societal dimensions to develop, inform, and teach cybersecurity solutions and policies for individuals and the nation and the global community. Now, of course, I'm preaching to the choir here when I tell you how important a holistic, multidisciplinary approach is and how that's needed to ensure the safety and security of medical devices. And with faculty that we have, like Victor Krauthammer, you're going to be hearing from later on, and James Phillips, and others, GW is extremely well positioned to make important contributions in this area. So, one other dimension of GW engineering that I'd like to mention that I think positions us well to tackle these really challenging problems is the diversity of our school community. Just to give you a few statistics here that are really pretty remarkable for an engineering school. Our first year undergraduate engineering class is 46% female. That is about double the national average in undergraduate engineering and computer science. That class is also 30% underrepresented minorities and 17% first generation college students. A recent ASEE report ranked us as the #1 engineering school in the country for the number of doctoral degrees awarded to underrepresented minorities. And 55% of the tenure track faculty that we've hired over the past 3 years are women. For those of you affiliated with engineering schools, you know that these are all pretty remarkable numbers. And that diversity and our school's commitment to equity and fostering a culture of inclusion is core to our belief that diversity of identity, thought, and lived experience is critical to innovation and to solving society's most challenging problems. We need different perspectives at the table when we're working on these really hard problems. So this is all a long way of saying that we are very excited to be hosting the CyberMed Summit here today, and I look forward to hearing about the discussions and the outcomes of your work. So thank you all for coming. Thank you to the organizers for making it all happen, and I wish you a very successful meeting.